Hi, I'm Tessa with Brainrot News, here with a few bits of medical malpractice from our so-called government for you to choke on.
Brainrot the news.
Part 1. The right's misadventures in undermining your health. Let's talk about healthcare, or at least what's left of it after being run over by the Trump administration like it was a possum crossing a 6-lane highway. If you believe healthcare is a human right, congratulations, you are a decent person. You believe that whether you are a janitor, a billionaire, or just some guy who eats string cheese with a knife and fork, you still deserve to see a doctor without signing away your firstborn child and a kidney. That vision, of course, stands in direct opposition to the worldview currently pissing on the White House lawn. Trump's second term has doubled down on the Republican notion that healthcare should be a brutal game of survival of the richest, with a healthy dose of social Darwinism. Their philosophy is simple. If you can't afford insulin, maybe you were never meant to survive in God's free market. This is not just a few bad policy tweaks. This is an ideological war, a full-scale siege on the very idea that the government should help people stay alive if there isn't a profit in it. Every decision, every budget cut, every bureaucratic sabotage has been crafted with one goal in mind: shrink public health protections down until they fit in the glove compartment of a luxury SUV owned by a United Healthcare CEO. And remember, America's healthcare system wasn't exactly winning gold medals to begin with. Compared to other developed nations, we already boast the highest costs, the worst outcomes, and the most GoFundMe accounts masquerading as insurance policies. Now, under the new reign of deregulation and corporate love letters, these cracks in the system are splitting wide open, and it's the poor, the sick, and the marginalized who are being shoved into them headfirst. Every time this administration throws out phrases like efficiency and cost savings, what they really mean is we are about to cut a life support line and call it fiscal responsibility. Behind every buzzword about freedom and innovation is a human being rationing their life-saving medication or bleeding out in an ER that just closed for cost savings. So if you were wondering whether healthcare was safe from the same wrecking ball they've been swinging at voting rights, education, and basic human dignity, sorry, it's already halfway to the grave, and the people holding the shovels are lobbyists. Let's get started. Part 2. RFK Jr. is beating public health to death with a rusty shovel. If you have ever wondered what would happen if you handed the keys to the nation's health infrastructure to a conspiracy theorist who thinks science is a deep state psyop, wonder no more. Robert F. Kennedy Jr., freshly installed as Secretary of Health and Human Services as of March 12, 2025, has wasted absolutely no time lighting the building on fire and locking the doors from the inside. One of his first big moves was blowing up the Department of Health and Human Services and duct taping its charred remains into something called the Administration for a Healthy America, a name that sounds suspiciously like it was ripped from the rejected slogans pile of a 1950s anti-fluoridation campaign, or I guess a 2025 anti-fluoridation campaign in this case. Under this master stroke of rebranding, critical agencies like the CDC and NIH are being gutted, with deep budget cuts and layoffs, slashing through the nation's already fragile disease tracking, pandemic preparedness, and basic public health infrastructure like a bad horror movie villain who just discovered power tools. Critics, and by critics we mean anyone who has ever passed a high school biology class, or hell, even just sat in on one, they are sounding every alarm that this is not reform. It is sabotage. Slashing disease surveillance and research funding after a global pandemic is a bit like removing the smoke detectors from your house because you already had one fire and survived. It doesn't stop there. RFK Jr. has taken a jackhammer to the scientific research community too, proposing a cap on indirect cost rates for NIH grants, a move that would financially kneecap every research lab that isn't already funded by Elon Musk's pocket change. Labs are already shuttering, and promising research is grinding to a halt. In RFK Jr.'s America, if your study isn't about miracle supplements, horse paste, or how kale is secretly microchipping you, you're out of luck. Research areas like diversity, equity, and inclusion, LGBTQ health, and vaccine hesitancy are being starved to death on purpose, because apparently public health is when you pretend marginalized people and basic immunology does not exist. And then came the autism comments, because of course they did. After the CDC reported new autism prevalence numbers, RFK Jr. took this opportunity to demonstrate that his grasp of neurodevelopmental science is about on par with a YouTube comment section. He described autism in terms so insulting, so medically inaccurate, that autism advocacy groups practically crashed the internet rushing to respond. Apparently, in in his America, autistic individuals are incapable of paying taxes, holding jobs, or forming relationships. A cruel, dehumanizing lie disproven by thousands of autistic adults living full, independent lives, like the writers, editor, and host of this show, for example. But RFK Jr. wasn't done embarrassing himself and endangering public health. No, he doubled down on his favorite greatest hit, blaming vaccines for autism. Despite the mountains of evidence debunking that claim so thoroughly, it might as well be buried under a Costco's worth of scientific consensus. He's now demanding massive new studies to find environmental causes of what he calls the autism epidemic, setting an absurd September deadline to solve autism like it's a crossword puzzle, all while stacking key public health initiatives with anti-vax cranks, conspiracy theorists, and anyone who seems genuinely confused about how vaccines work. This is not just fringe science creeping into public policy, it's turning public health into a cult meeting with a government budget. RFK Jr.'s reign at HHS isn't just an embarrassing sideshow, it is a direct, targeted assault on science, on medical progress, and on every vulnerable community that actually depends on a functioning, reality-based public health system to survive. And if you think the consequences will be limited to conspiracy theorists at freedom rallies with anti-mask bumper stickers, think again. This hits hospitals, universities, children's health, vaccine supply chains, and anyone who's ever had so much as a bad flu. This is not a drill. It is the slow, intentional demolition of evidence-based medicine, and the collateral damage is all of us. Part 3. Legislative and executive sabotage. If you are still clinging to the fantasy that healthcare is a right in America, the Trump administration is here to personally rip that illusion from your cold, uninsured hands. Since day one of his second term, Trump and his band of ideological arsonists have been lighting fire to the Affordable Care Act like it's a witch in Salem, rolling back every executive order that even dared to whisper about making healthcare accessible or affordable. By reversing expanded enrollment periods or slashing funding for outreach programs enacted by the previous administration, they effectively took a wrecking ball to the very infrastructure meant to get Americans insured. The result is predictable. Fewer people signing up, more uninsured families, and a healthcare system that's increasingly only for those rich enough to never really need it. And if you're part of a marginalized group, congratulations. You are their favorite punching bag. Trump's flurry of executive orders reads like a dystopian manifesto. Executive Order 14187, charmingly titled Protecting Children from Chemical and Surgical Mutilation, and Executive Order 14168, Defending Women from Gender Ideology Extremism, are not about protecting anyone. They are about legislating cruelty, banning gender-affirming care, and forcing an extremist vision of gender onto every American who does not fit neatly into the 1950s stereotypes. It is not policy. It is state-sponsored bigotry in a suit and tie. Now, reproductive rights are being gutted with gleeful efficiency by rescinding protections for reproductive health care services. The administration has all but announced that women and people who can get pregnant are second-class citizens whose autonomy can be legislated away with a few strokes of a pen. And just to make sure no one escapes unscathed, they are planning to let the ACA premium tax credits expire, skyrocketing insurance costs and pushing millions back into the ranks of the uninsured. The Trump administration isn't just incompetent, it's hostile. Every order is a love letter to the idea that if you cannot afford healthcare, you do not deserve it. Of course, bypassing Congress through executive orders means they get to bulldoze democracy while they're at it. No messy debates, no pesky hearings, just pure, undiluted authoritarian policymaking, signed, sealed, and delivered straight to the most vulnerable among us. But even this blitzkrieg of cruelty isn't going unchallenged. Lawsuits are piling up as civil rights groups fight back, pointing out that many of these decrees are not only morally bankrupt, but legally flimsy enough to crumble under real scrutiny. At its core, this entire strategy is a war on marginalized communities. The targets, including trans and gender non-conforming people, low-income families, immigrants, and people of color, are chosen with surgical precision. It is not just about reforming healthcare. It is about reinforcing a caste system where basic human dignity, let alone basic medical care, is a luxury item. They are doing this out in the open with no shame, no apology, and no camouflage. This is not healthcare policy. It is ideological warfare dressed up as governance, and unless it's stopped, the human cost will be measured in lost lives, not just lost coverage. Part 4. Budgetary Strangulation. If you thought the Trump administration's plan to wreck healthcare stopped at banning gender-affirming care and sabotaging insurance access, think again. They've also set their sights on smashing the very infrastructure that makes public health even remotely functional, and they're doing it with all the subtlety of a wrecking ball strapped to a monster truck. The latest federal budget proposal doesn't just trim funding for the Department of Health and Human Services, it kneecaps it, proposing to hack away a third of its funding like a maniac with a rusty hatchet. The Centers for Disease Control and Prevention is slated for a 44% budget cut because apparently we learned nothing from the pandemic. The National Institutes of Health are up for a 40% reduction because why waste money on silly little things like cancer research or new antibiotics when you could reroute it to tax breaks for billionaires? And it does not stop with just the big names. Entire lifelines are being set on fire. Head Start, HIV and AIDS initiatives, the Health Resources and Services Administration, the Substance Abuse and Mental Health Services Administration, the Agency for Healthcare Research and Quality, and the Administration for Community Living are all on the chopping block. If you need mental health care, HIV prevention, elder services, early childhood support, or pretty much anything that doesn't involve rich people getting richer, you're out of luck. This isn't fiscal responsibility, it's social arson. Just to pour some extra gasoline on the fire, the administration has decided that those billions of dollars allocated to fight COVID-19 needs to be clawed back from state and local health departments too. Infectious disease tracking, vaccination programs, public health infrastructure. Hope you like crossing your fingers and hoping for the best, because that's your new pandemic plan. But maybe, if you squint hard enough, you'll see a glimmer of strategy. They are not just cutting budgets randomly. They are deliberately making sure that when the next health crisis hits, the government will be powerless to respond, and corporations will be there to pick the bones clean. Short-term savings, long-term death tolls. It's austerity for the masses and blank checks for private industry, all under the laughably transparent excuse of fiscal responsibility. Let's not forget the dark comedy of Robert F. Kennedy Jr. standing in front of the American people and declaring he wants to end America's epidemic of chronic illness, while simultaneously greenlighting the annihilation of chronic disease prevention programs. That's like promising to cure hunger by closing every grocery store and setting fire to the farms. It would almost be funny if it weren't going to kill people. Buried inside all these cuts and chaos is the shiny new Administration for a Healthy America, a cute little rebranding exercise that consolidates gutted departments into a single bureaucratic monolith. In theory, streamlining sounds efficient. In practice, it is about stripping away expertise, centralizing decision-making into political hands, and turning the nation's health department into a tool for ideological enforcement. Who needs independent scientists when you can have loyal apparatchiks rubber stamping whatever madness RFK and Trump cook up next? This is not policy reform. It is a systemic wrecking ball, a cold, calculated plan to starve public health until it collapses, making healthcare something you buy at auction if you're lucky enough to survive long enough to bid. And if we do not stop it, the next time a crisis comes, there will not be a public health system left to respond. There will only be the scavengers waiting to profit from it. Part 5. Reallocating funds and undermining science. If you were hoping science might survive the Trump administration's second term, bad news. They're not just gutting public health, they are trying to break the very machinery of scientific research itself, and then sell the scraps to the highest bidder. It starts with what they're calling a 15% cap on indirect costs for NIH grants. And if that sounds boring, trust me, it is not. It's a bomb disguised as budgetary policy. These indirect costs keep the lights on in research labs, pay the people who sterilize equipment, maintain data security, and make sure that actual human scientists can spend their time curing cancer instead of fixing the plumbing themselves. Slash those funds, and suddenly universities and hospitals aren't research hubs anymore. They are empty buildings with a few sad grad students left holding the pipettes. Temporary court rulings have blocked this cap for now, but the administration is hell-bent on starving science at the source, making sure the next generation of breakthroughs dies in the lab before it ever reaches a patient. It gets worse. They're not just choking off resources, they are hand-picking who gets to do science at all. Grants focused on diversity, equity and inclusion, LGBTQ health, and vaccine hesitancy are gone. If your research questions the administration's narrative, if it suggests that marginalized people deserve care, if it so much as implies that vaccines are good, you can kiss your funding goodbye. It is not science. It's a political loyalty test masquerading as grant reviews. This is censorship with a budget line, a slow purge of inconvenient facts dressed up as policy realignment. Instead, they're throwing money at their pet project, the Make America Healthy Again Commission, a new initiative to study the root causes of chronic illness, particularly in children. Sounds sorta harmless until you realize that in Trump world, root causes probably involve blaming everything on vaccines, windmills, soy milk, or insufficient Christian prayer. This is not about advancing public health. It's about laundering conspiracy theories into something that looks like legitimate science, while starving real research until it collapses under the weight of bureaucratic sabotage. If you thought the pharmaceutical industry might finally get reined in, think again. Despite all the populist bluster and bullshit about cutting drug prices, the administration's real actions, including deregulation, weakening price controls, and stacking the FDA with industry cronies, suggest they are more interested in helping Big Pharma price gouge patients into oblivion rather than saving anyone a dime. It's almost impressive. They have managed to both gut scientific research and make it harder and more expensive to access whatever medical innovations somehow survive the purge. At its core, this is not incompetence. It is the deliberate weaponization of healthcare and science as tools of ideological control. Research that uplifts marginalized communities will be erased. Programs that promote equity will be defunded. And science that might embarrass the administration or contradict the cult narrative will be silenced. What we are watching isn't just a budget fight. It's the systematic dismantling of evidence-based policy in favor of a reality handpicked by grifters, ideologues, and profiteers. If we let them get away with this, the damage will not just be measured in dollars lost. It will be measured in preventable deaths, abandoned cures, shattered communities, and a future where the truth itself is just another casualty of power. Part 6. Deregulating Us to Death. The Trump administration's healthcare reforms are what happens when you let libertarian fever dreams and big pharma lobbyists co-author public policy. Under the buzzword of deregulation, they are not freeing patients. They are dismantling every basic safeguard that keeps healthcare from turning into the Hunger Games for the sick and dying. Let's touch on Trump's idea of price transparency. Trump's people love to frame this as a bold, populist move forcing hospitals and insurers to post prices for procedures and treatments so consumers can shop around for their cancer surgery like it's a Black Friday deal on flat screen TVs. And that all sounds great until you realize that most people do not get to comparison shop while having a stroke. And even if they could, the listings are deliberately opaque, inconsistent, and often useless without an insurance decoder ring and a background in forensic accounting. Plus, the administration has done next to nothing to enforce the transparency rules they so loudly tout. It's the healthcare equivalent of putting a sale sign on a burning building and calling it consumer protection. Meanwhile, in the prescription drug market, where Americans already pay more than anyone else on the planet, Trump's crew has been busy pushing for deregulation under the guise of access. They flirt with ideas like drug importation without seriously addressing safety standards. They gut regulations on telehealth prescribing, and they posture about insulin and EpiPen affordability while doing jack all to actually lower the prices in ways that matter. Their real energy, of course, is spent trying to dismantle Medicare drug price negotiation, the one mechanism that could force Big Pharma to stop treating basic medicine like a luxury yacht timeshare. Let's not forget, while pretending to champion the little guy, the administration is quietly making it easier for pharmaceutical companies and medical device manufacturers to flood the market with products under weaker safety standards. Human subject protections are being watered down. Clinical trial reporting requirements are being relaxed, and oversight of experimental treatments are being shunted aside for the sake of innovation, which here reads as profit without accountability. Tying the whole rotten package together is the Make America Healthy Again Commission, a politically weaponized group whose real mission isn't improving public health, it's dictating which science gets funded based on political loyalty rather than medical necessity. In their world, research into autism caused by vaccines, a conspiracy theory so dead it's decomposing, gets prioritized, while studies on racial health disparities, gender-affirming care, or the real causes of chronic illness get defunded or shoved into bureaucratic oblivion. All of it. Every half-assed price transparency rule, every deregulatory reform, every gutting of research oversight points to one brutal reality. This administration does not believe in healthcare as a public good. They believe in healthcare as a commodity, one that only the wealthy deserve to access safely and affordably. If you're poor, marginalized, sick, or just unlucky, good luck out there. Hope you remembered to comparison shop for that ambulance ride. What Trump's people call cutting red tape is really about cutting you from the protections, rights, and services that once stood between you and medical bankruptcy, suffering, or death. And they are doing it gleefully, openly, betting that enough people are too exhausted, too scared, too sick, or too confused to stop them. But we are not confused. We see exactly what they are doing, and no amount of slick press conferences or patriotic branding will hide the blood on their hands. Part 7. Medicine versus Malice. While the Trump administration continues to treat healthcare like a hedge fund liquidation sale, an army of doctors, nurses, researchers, and patient advocates have been fighting like hell to hold the line. Across the healthcare world, the response has been loud, furious, and unified. This is not just bad policy, it's malpractice at a national scale. Organizations like the American Medical Association and the American Hospital Association haven't minced words. They've blasted Trump's healthcare agenda for gutting Medicare physician payments, jamming even more bureaucratic red tape into an already broken system through bloated prior authorization requirements, and greenlighting dangerous expansions of medical practice to non-physician providers without proper oversight, all under the paper-thin excuse of efficiency. Because efficient healthcare is when you have a sleep-deprived urgent care tech diagnose your heart attack on a Zoom call. Public health groups like the American Public Health Association and grassroots initiatives like For Our Health have been equally savage. They are warning that the administration's budget hacks will shred the nation's already fraying public health safety net, leaving us hilariously underprepared for the next pandemic, climate disaster, or basic flu season. Apparently, the plan is to just cruise through the next health crisis with good vibes and ivermectin. Patient advocacy groups from disability rights coalitions to LGBTQ health advocates have made it crystal clear. The Trump administration's policies will hit marginalized communities the hardest, from rolling back Medicaid expansion and blocking gender-affirming care to restricting reproductive health. It's a greatest hits album of cruelty that disproportionately screws over the sick, the poor, the disabled, and the politically inconvenient. In other words, if you're not rich, cis, straight, and healthy, you are expendable. Researchers and academics are openly sounding the alarm about the administration's war on science itself. Slashing funding for life-saving research, politicizing grant decisions, and installing ideologues to oversee scientific agencies aren't just bad ideas. They are the blueprint for a slow-motion societal collapse. And when the next preventable disease outbreak happens because your local health department got defunded and replaced with a Make America Healthy Again pop-up tent, you'll know exactly who to thank. The resistance isn't just symbolic. It's lawsuits, court challenges, public campaigns, professional strikes, and blistering open letters signed by thousands of medical experts demanding that the government stop treating healthcare like an afterthought and start treating it like the basic human right it is. Across every corner of the healthcare ecosystem, the message is clear. The Trump administration's policies are not just misguided, they are a direct, reckless, and systemic assault on public health itself. The only question now is whether the rest of us are willing to fight back hard enough, fast enough, and fiercely enough to stop the damage before it becomes irreversible. Part 8. Reclaim healthcare before they burn it to the ground. What you have just heard is not a random assortment of bad decisions. It is a deliberate, scorched earth campaign against the very idea that healthcare should be a human right in America. It is not incompetence, it is sabotage. And if it's allowed to continue, it will leave a healthcare system so gutted, so hollowed out, that future generations will talk about good healthcare the way we talk about rotary phones, as something quaint and long dead. The Trump administration has not just targeted the Affordable Care Act, it's gone after every safeguard designed to make sure basic human survival is not reserved for the rich. They have dismantled reproductive rights. They have criminalized gender-affirming care. And they have plotted to let the ACA subsidies expire, turning insurance premiums into luxury items. And they have slashed budgets for the CDC and NIH mid-measles outbreak, because what better time to defund disease research than right after we see a preventable deadly disease make a comeback? They have politicized science itself, cutting off grants that do not fit their ideological purity tests. They have muzzled public health institutions, turned research funding into loyalty oaths, and shoved critical healthcare decisions further into the hands of profiteers and grifters. Every move, every budget slash, every executive order has sent one message loud and clear. If you're poor, sick, disabled, queer, a person of color, or just unlucky enough to need medical care, you are disposable. Despite all this carnage, the resistance is real. Healthcare workers, patient advocates, public health experts, and everyday people have stood up and screamed, enough. They have filed lawsuits. They have mobilized communities. They have marched, organized, and demanded better. And they are reminding the world that healthcare is not a favor you beg for. It is a right you fight for. Here's what we can do. Raise hell, write, protest, organize, sabotage their narrative at every turn. But vote like the whole goddamn health system is teetering on the edge, because it is. Support unions, build coalitions, drag these policies into the daylight and name them for what they are: a death sentence for the poor, the marginalized, and the disabled. And when they tell you it's about medical freedom, spit the truth back in their faces. Freedom without healthcare is just a slow death you cannot afford to treat. Healthcare is a human right. It always has been, and it always will be. But rights do not defend themselves. People do. And if we do not fight like hell right now, they are going to take everything that's left. Thanks for watching Brainrot News. Like, comment, and subscribe before the Trump administration decides you have to prove citizenship, blood purity, and a $5,000 copay just to get a checkup.